Dear student, welcome to E-Pathshala, and today you have chosen to learn about diabetes screening tests. I am Dr. Uma Mageshwari from the Department of Food Service Management and Dietetics, and I am happy to be talking about diabetes screening tests and inform you about this. Diabetes mellitus is becoming an endemic disease in this century, and the World Health Organization cautions that the prevalence is expected to increase at an alarming rate in the near future. Because of diabetes mellitus, mortality and morbidity rates due to its complications are also increasing. So the best way to control the prevalence of diabetes is twofold. One is to prevent the occurrence through adapting a healthy lifestyle, and secondly, diagnosing early and controlling the condition. In this lesson, dear student, you will be understanding the various tests to screen diabetes and learn the principles and the standards. As you know, diabetes is high blood sugar, and the International Diabetes Federation defines it as a condition where high blood glucose concentrations result in an individual from defects in insulin secretion, insulin action, or both. There is an abnormality in the metabolism of carbohydrate, protein, and fat, and the complications are severe in uncontrolled conditions. To refresh you about diabetes, diabetes is of various types. There is type 1 diabetes, type 2 diabetes, gestational diabetes, other specific types, and pre-diabetes. Whatever may be the type of diabetes, the screening is common for all. Normoglycemic values or normal blood sugar values might differ for gestational diabetes and the other types, but the screening is the same. Now let us see who should test for diabetes. Testing or screening for diabetes should be considered for all individuals at 40 years and above, particularly among those with a body mass index of 25 kg or more. Physicians advise that tests should be done frequently, that is every 3 months, if a person is a potential diabetic. A potential diabetic is an individual who has a family history of diabetes, who is obese, and is leading a sedentary lifestyle without much physical activity. Testing should be considered at a younger age or be carried out more frequently in individuals who are overweight and have additional risk factors like habitually physically inactive, have a first degree relative with diabetes, and are members of a high risk ethnic population, and for a woman who has delivered a baby weighing more than 9 pounds or 4 kgs, or who has been diagnosed with gestational diabetes, people who are hypertensive, people who have a low level of high density lipoprotein or a high level of triglycerides, those who have polycystic ovary syndrome, and those people who on previous testing have impaired glucose tolerance or impaired fasting glucose, and those people who have other clinical conditions associated with insulin resistance, and of course all those who have a history of vascular diseases. So the above said population groups have to go in for screening very often, and screening for diabetes can be carried out either in the blood sample or in the urine sample. First, let us see what are all the tests which are done to screen diabetes using the blood sample. The first one is fasting plasma glucose test. A fasting plasma glucose test, also known as a fasting glucose test or FGT, is a test that can be used to help diagnose diabetes or pre-diabetes. The fasting glucose test measures blood glucose after an overnight food consumption for at least 8 hours. A glucometer or a glucose oxidase method is used to find out the blood glucose values. The World Health Organization defines the following fasting glucose test results. An individual who has a blood sugar of 110 mg per dl is considered as normal. A person is said to be having impaired fasting glucose when the blood sugar is between 111 to 125 mg per dl, and people become diabetic when the sugar level increases from 126 mg per dl and above. Apart from the fasting blood glucose test, a postprandial blood glucose test is also used for screening. Postprandial measurement means that the blood glucose level is tested after 2 hours of consuming a meal. The PP values or postprandial values give an idea of how an individual responds to a meal of carbohydrate intake. The WHO specifies the values as you see in the chart. Now the next one is random blood glucose test. Diabetes screening is possible whenever the blood glucose level can be checked at any time of the day, and this is called as random values. Either a glucometer or the method of glucose oxidase can be used to estimate the blood glucose. The values for a normal random blood glucose level should be within 200 mg per dl as per WHO standards. Now let us move on to the next type of important tests, which is the C-peptide test. The principle of this test is based on the fact that C-peptide is released at the same time as insulin in our body. For each molecule of insulin produced, a molecule of C-peptide is released and it remains in the blood longer than insulin. This makes it as a useful marker of insulin production. C-peptide by itself does not influence any blood glucose control, and hence a high level indicates that insulin is produced but is not utilized by the body, and this condition is known as insulin resistance. On the other hand, if a low level of C-peptide is noticed, it indicates that insulin produced by the pancreas is less, and hence the individual is a type 1 diabetic. When can a C-peptide test be performed? Well, a C-peptide test can be performed for any of the following reasons you see here. To distinguish whether an individual has type 1 or type 2 diabetes, to investigate whether an individual has insulin resistance, to ascertain the causes of hypoglycemia, and to monitor insulin production after the removal of a tumor of the pancreas. Now, knowing that, let us understand how the test is done. The procedure requires measuring of a C-peptide in the fasting blood. A fast for 8 to 12 hours Before the test is important, and oral hypoglycemic drugs have to be avoided before the test is done. A sample of blood will be taken and levels of C-peptide will be measured as well as the blood glucose level. If the test is to diagnose either type 1 or type 2 diabetes, an injection of glucagon may be given in the arm between two blood samples in an attempt to stimulate insulin production. The normal range for a C-peptide test is 0.51 to 2.72 Ng per ml. High levels of C-peptide with a low level of blood glucose could be an indication of insulin resistance, either type 2 diabetes or Cushing's syndrome, and low levels of C-peptide and high blood glucose level can be an indicator of type 1 diabetes. Now, understanding the C-peptide test, let us move on to the most commonly followed test for screening diabetes, which is the oral glucose tolerance test. In cases when there is impaired glucose tolerance or fasting blood glucose is normal but postprandial is high, or vice versa, the physician might advise a oral glucose tolerance test. OGTT, as it is called, it is a method which can help to diagnose instances of diabetes mellitus or insulin resistance. The test is used to determine whether the body has difficulty in metabolizing the intake of carbohydrate. This test is also done in fasting stage. The patient is asked to take a glucose drink, that is glucose which is mixed in plain water, and the blood glucose level is measured before the glucose drink and at intervals of 30 minutes, 1 hour and 90 minutes. As you can see in the graph, the values denote moderate or severe hyperglycemia. The test is useful to diagnose prediabetes, gestational diabetes among pregnant women, insulin resistance, and reactive hypoglycemia. As you can see in the graph, people without diabetes have a fasting value which is below 6 millimoles, and people with impaired glucose tolerance have a fasting value which is 6 to 7 millimoles. Diabetic levels, the fasting value is over 7, and at 2 hours it is above 11 millimoles per liter. Lifestyle changes is advised if the values are within the impaired glucose tolerance range, and if diabetic, then either oral hypoglycemic drugs will be advised along with dietary restrictions. Next is glutamic acid decarboxylase autoantibodies or GAD antibodies test. This test is used to find out whether someone has either type 1 diabetes or latent autoimmune diabetes of adulthood, also known as LADA. It is a blood test which measures whether the body is producing a type of antibody which destroys its own GAD cells. A number of autoantibodies are thought to circulate in type 1 diabetic, including those which target glutamic acid decarboxylase, and hence presence of these autoantibodies suggests type 1 diabetes. If the patient is not overweight and where a type 2 diabetes diagnosis is in doubt, this test may be used. The test may also be used to determine whether gestational diabetes may be type 1 diabetes. Presence of the GAD antibodies is observed in 75% of people with type 1 diabetes at diagnosis. If no GAD antibodies are present, the test cannot be conclusive in saying that the patient does not have type 1 diabetes. Moving on to glycosylated hemoglobin test or the HbA1c. The HbA1c test, also known as the hemoglobin A1c or glycated hemoglobin test, is an important blood test which indicates the control of blood sugar in a diabetic. HbA1c occurs when hemoglobin, the oxygen carrying protein in red blood cells, becomes bonded with glucose in the bloodstream. The bonding with glucose is called as glycation. The higher a person's blood glucose levels have been, the higher the number of red blood cells that will have become glycated, and therefore the higher HbA1c levels indicate an uncontrolled or poor diabetic control. HbA1c tests are not the primary diagnostic test for type 1 diabetes. The World Health Organization suggests the following diagnostic guidelines for diabetes. A HbA1c value below 6% is normal and it is seen in a non-diabetic. A HbA1c value between 6 to 6.4% indicates pre-diabetes or impaired glucose regulation, and a value of 6.5% or over confirms type 2 diabetes. As the half-life of red blood cells is for 3 months and HbA1c levels generally reflects a person's blood glucose level over the previous 8 to 12 weeks. While HbA1c tests are usually reliable, there are some limitations to the accuracy of the test. People with different forms of anemia may not have sufficient hemoglobin for the test to be accurate, and being pregnant or having an uncommon form of hemoglobin or short-term illnesses can cause a temporary rise in the HbA1c values. Next test is glycated serum protein test. The glycated serum protein test diagnoses the presence of fructosamine. Both fructosamine and the HbA1c tests are used primarily as monitoring tools to help people with diabetes control their blood sugar. A high fructosamine means that a diabetic's average glucose over the previous 2 to 3 weeks has been elevated. Instances where fructosamine may be a better monitoring choice than HbA1c includes rapid changes in diabetes treatment, a diabetic pregnancy, a shortened RBC lifespan, and abnormal forms of hemoglobin. A normal fructosamine level may indicate that a diabetic has good diabetic control and that the current treatment plan is effective for the individual. Since the fructosamine levels of people with well-controlled diabetes may overlap with those of people who are not diabetic, the fructosamine test is not much used as a screening test for diabetes. Now, the next test is Glycomark blood test. The Glycomark blood test does not require any fasting or other special preparations, and normal medications may be taken before the test. This blood test is used to assess glycemic control and fluctuations over a 1 to 2 week period. The Glycomark blood test is a relatively new laboratory test and is used in conjunction with HbA1c, which looks at glycemic control over a 2 to 3 month period. The test is very useful in determining if an individual is experiencing extreme spikes in blood glucose levels after meals. The test works by measuring the level of 1,5-anhydroglucitol or 1,5 Ag in the blood. 1,5 Ag is a blood sugar that, like other blood sugars, such as glucose, is absorbed by the kidneys. The kidneys only need a certain amount of blood sugar, and so when their glucose blood level spikes above 180 mg per dl, the 15 Ag blood sugars are passed out of the body as waste and their presence in the blood is decreased. It takes approximately 2 weeks for the 15 Ag levels to get back to normal. A lower level of 15 Ag in the blood indicates poor glycemic control, and test results are interpreted by looking at the levels of 15 Ag found in the blood. Now the next test is by using a glucometer. A glucose meter or glucometer is a medical device for determining the approximate concentration of glucose in the blood. It is a device useful for self-monitoring of blood glucose. A small drop of blood obtained by pricking the skin with a lancet is placed on a disposable test strip that the meter reads, and that is used to calculate the blood glucose level. The meter then displays the level in units of milligram per dl or millimoles. Now that we have seen the blood samples, let us see the screening test by using urine samples. Apart from the blood test, urine samples are also used for screening diabetes. The most common method used earlier was the Benedict's method. The glucose urine test measures the amount of sugar or glucose in a urine sample. The presence of glucose in the urine is called as glycosuria or glucosuria. The Benedict's agent is prepared with 173 grams of sodium citrate and 100 grams of anhydrous sodium carbonate, which is dissolved in 600 ml of water over heat. A solution of copper sulfate containing 17.3 grams in about 100 ml of water is added slowly. This is cooled and transferred to a volumetric flask and made up to the mark with water. This is the Benedict's solution. About 5 ml of Benedict's solution is taken and 5 to 8 drops of urine is added and is heated over or in a boiling water for 2 minutes, and then the solution is allowed to cool. The change in color tells the amount of glucose present. As you see in the test tubes, a red brick precipitate is uncontrolled diabetes. The major principle behind this test is that a hot alkaline solution of cupric sulfate is oxidized to a reducing sugar like glucose and fructose and produces a brick red precipitation of cupric oxide. Now we will move on to see the glucose oxidase impregnated strips or the dipstick method. The dipstick has glucose oxidase at the end of the strip. When this is dipped in urine sample, the reagent is allowed to react with the glucose for 1 minute. Color will develop, which will show the amount of glucose present. The glucose urine test may be ordered when the doctor suspects renal glycosuria. This is a rare condition in which glucose is released from the kidneys into the urine even when the blood glucose is normal. In the dipstick method, higher than normal levels of glucose may occur when there is diabetes. Small increases in urine glucose levels after a large meal are not always a cause of concern. During pregnancy, half of the women have glucose in their urine at some time during pregnancy. Glucose in the urine may mean that a woman might have gestational diabetes and renal glycosuria, which is a rare condition in which glucose is released from the kidneys into the urine even when blood glucose levels are normal. So far, dear student, we have seen that diabetes screening is important for all people who are above the 40 years of age And for those who have a heredity of diabetes in the family, those who are obese, who lead a sedentary lifestyle, and those women who have polycystic ovarian syndrome. Now, diabetes screening becomes very important and has to be done at regular intervals so that it can be prevented, and those people who have diabetes running in the family can always delay the onset of diabetes. Our changing lifestyle and our very low physical activity has made diabetes a very important disease which has to be of concern, and screening of diabetes is the only way to find out whether a person has diabetes or not. Now, screening, as you saw, it can be done by using both blood and urine samples, and there are very easy methods